And joining us now in studio, Dr. David Goldbloom, new chair of the Mental Health Commission of Canada and senior medical advisor at CAMH. Want to remind you that we are live streaming our program tonight. Our producers are hosting a live chat right now on the website tvo.org/mentalhealthmatters. And a representative from the helpline at Connects Ontario is also part of that chat, so chime in on the live chat or send us a tweet via Twitter. We're using the hashtag #TheAgenda or the hashtag #MentalHealth and join our conversation. Dr. Goldbloom, good to have you here in TVO.
Great to be here, and thank you for shedding such a light on this all week.
This is it, eh?
This is the document.
This is the one. Shall we start with a clip from today's big launch, and then we'll come back and chat. Roll tape, please.
Hello, everyone. My name is Valerie Pringle. I'm your Master of Ceremonies, and I would like to welcome all of you here in the room. I would like to welcome everyone who is joining us on the web and live on television for the launch of one of the most significant documents in recent history, the Mental Health Strategy. Hallelujah. It is a good day.
Her interest in this is more than just professional, right? She's got a daughter, Catherine, who's done some good work for your organization.
Absolutely, and Valerie has become an incredible spokesperson on behalf of families and her daughter, Catherine, in terms of people with experience of mental illness.
So what does all this mean?
Well, this means, I think, that we're at a critical juncture in our history in Canada, building on the work of lots of people over many years, but suddenly coalescing it into a strategy for the entire country that I hope will translate into a meaningful difference in the lives of people with mental illness and their families, but also something that makes a meaningful difference for all Canadians.
I kept hearing, we've been doing programs on this for a while, and people have kept saying to me, we don't really have a mental health strategy in this country. We're one of the very few countries in the world that doesn't have one.
That's right.
How is that?
You know, it's not as if everyone has been asleep at the switch all of a sudden. Every province, every territory has, in their own way, grappled with developing initiatives, strategies, plans, but we've never taken a look at it as a whole. And in some measure, that may reflect the constitutional realities of healthcare in our country and the way healthcare is governed. And that really led to the creation of the Mental Health Commission as a national organization, not federal, not provincial, not territorial. So we actually exist outside the constitutional framework of health, and maybe that provided us with a safe zone for trying to bring together examples from all over the country of great things that are being done, but also pointing out for all of us how we need to do things better.
If this was in fact a decade in the making,
Yes.
What went into getting to this?
Well, it started, I think, with the Senate committee, the Committee on Social Affairs, Science and Technology, which began a decade ago looking at the problem of mental illness in Canada and issuing really the most comprehensive report on the status quo of mental illness that our country has ever seen. And they came up with a series of recommendations, principal among them the creation of a National Mental Health Commission. And it was enacted by Stephen Harper in 2007. And, you know, I want to say that it's a nonpartisan issue.
I think a Liberal, Michael Kirby, was the chair.
Michael Kirby, a dyed-in-the-wool Liberal, was the chair of that Senate committee. And I think it speaks to the fact that every party recognizes this is a problem we need to do something about. So the creation of the Mental Health Commission in 2007 was given a mandate, and among the tasks was to produce Canada's first ever national mental health strategy. And some people say, well, you probably could have done that in a week. Yeah, I suppose we could have closeted some policy people and have them crank something out. It's not the way we chose to do it. We consulted literally thousands of Canadians from coast to coast to coast. We held a series of workshops, focus groups, all kinds of ways, online and in person, for Canadians to contribute to this. And that included people with lived experience of mental illness, family members, health professionals, researchers, policymakers, and the general public. So we heard lots of voices, and as you might imagine, a wide range of opinions.
So presumably this has, in your view, added legitimacy because you've gone through that whole thing that took so long.
I hope so. And you know, when you try to produce a synthetic document like this, inevitably, you leave out things that people felt were important, you include things that people disagree with. But it took us a long journey to get to this point, and my hope is that for Canadians reading this document, that they'll find the vast majority of it is things that they can agree with, things that they can champion, support, and advocate for.
Here's the, I don't have to tell you, here's the trouble. Governments everywhere are cutting back. And this report wants $4 billion more,
Right.
which may be all well and good, and I'm sure you've got every dime figured out how you want to spend to improve people's lives. But I don't see any government anywhere in the country saying, getting into a line saying we want to spend more on anything.
Right.
So how are you going to do that?
It's a challenge, and one of the things we've done all the way through the development of this strategy is have a reference group, provincial and territorial, of people from government to keep an eye on this process and to legitimize its proposals, but also at the level of the Mental Health Commission itself, our board that finally approved this document consists of civilians like me, but it also consists of government-appointed representatives, deputy ministers of health at the federal, provincial, and territorial level who have signed off on this document.
That's all well and good. They're not the Minister of Finance.
No, they're not. But, I think what we've seen, and particularly over the last 4 years since the creation of the Mental Health Commission, is a political awareness that this has been a far too neglected area for too long. We saw a couple of years ago the federal government choosing to invest $110 million in the plight of the homeless mentally ill in Canada by giving the Mental Health Commission those funds to develop the largest research project in the world on homelessness and mental illness in 5 Canadian cities. In the most recent budget, we've seen the federal government give new monies at a time of cuts, new monies to fund a depression research intervention network in collaboration with the Mental Health Commission.
So it's not hopeless, you think?
It is not hopeless, and I think there's also a bottom line economic argument here that this costs, at its current level, $51 billion a year to the Canadian economy, so that doing nothing and not investing is going to represent an additional financial burden.
There is plenty of good reading in this report, but I want to take a second and just get comfortable, if you want, here, Dr. Goldbloom, because I got 6 points I want to read out from the report just to bring everybody up to speed on this.
Sure.
A 6-pronged strategy.
Right.
Number 1, promote mental health across the lifespan in homes, schools, workplaces, prevent mental illness and suicide wherever possible. Point 2, foster recovery and well-being for people of all ages living with mental health problems and illnesses and uphold their rights. Point 3, provide access to the right combination of services, treatments, and supports when and where people need them. Point 4, reduce disparities in risk factors and access to mental health services and strengthen the response to the needs of diverse communities and Northerners. Point 5, work with First Nations, Inuit, and Métis to address their mental health needs, acknowledging their distinct circumstances, rights, and cultures. And finally, point 6, mobilize leadership, improve knowledge, foster collaboration at all levels. One of the things that we've heard over and over again as we bring those points to bear here is that there is no mental health treatment system in Canada. Can you explain, because we just heard that from literally dozens of guests. What does that mean, we have no mental health system in this country?
What it means is that we have a highly fragmented array of supports and services and treatments, and that for our citizens, the quality or even the very access to service becomes a pretty random process.
So no coordination.
No coordination, and also no front door. So people don't know where to go. Now, the reality is for most Canadians who are unsure if they're having a mental health problem or an illness, the first place they typically turn is their family physician. And there's a great deal more that we can do and that we need to do in bolstering the ability of those people on the front lines of primary care to deal with mental health problems and illnesses. This is not a plan for having 40 gazillion psychiatrists or psychologists brought in for every Canadian. That's not the plan. We need to have tiers of care. We need to bolster not only some of our traditional sources of care, but things like peer support, things like supportive housing, which can make a huge difference, employment opportunities that provide people who are experiencing mental illness the income and dignity that employment provides for people. There's a whole range of things that we need to do to give teeth to the word recovery, which is so prominent in this document.
Let me ask you about one of them then.
Yeah.
We hear complaints all the time there aren't an adequate number of psychiatrists or access to psychiatric services in this country. So does this strategy include having provincial health insurance plans cover other services, access to psychologists or other services of that nature?
Right. And we have raised in the strategy the issue that access to psychotherapy, and particularly our evidence-based psychotherapies, by which I mean those forms of psychological treatment that have been clearly demonstrated to make a difference in people's lives. Right now, we have very unequal access to that in Canada because it's largely in a private system, unless you're at a hospital or a community agency. If we look at other jurisdictions like England and Australia, they're ahead of us in making those kinds of psychotherapy services publicly funded and more broadly available.
They spend more too.
And they
spend
more.
a bigger chunk of their healthcare dollar.
They spend a significant percentage more of their health budgets, in the range of 10 to 11% of all healthcare spending, on mental health services, whereas in Canada, we're significantly lower, and it's one of the reasons that we've said the spending has to go up. Now, let me add, though, this is not the classic Canadian cry for more money as the solution. I believe that the solutions are far broader than simply saying, throw more money at this problem. And in fact, the range of the strategic directions speaks to those non-monetary issues that need to change, as well as the underfunding of appropriate services.
Let's finish up on this before we get the others to join us for a further debate on this report. This strategy makes abundantly clear that we have a serious have and have-not situation in this country. And if you live on a reserve in a remote part of Canada, the access to mental health services is obviously terrible.
Right.
And the suicides are through the roof, and we know about all of this. How does this report propose to close that gap?
We have been working, one of our advisory committees at the Mental Health Commission has been a First Nations, Inuit and Métis advisory committee who have had very significant input, as well as national Aboriginal organizations, into the recommendations that relate to that particular strategic direction. We have a long and sorry history of imposing solutions crafted in the South, if you will, on populations without engaging them, in the same way that we haven't properly and fully engaged people with lived experience and their families in the planning for, the administration of, and the evaluation of services. So we've been working in lockstep with our First Nations, Inuit and Métis communities to develop interventions that are going to be specific and meaningful to those populations. For instance, we have a first responder program called Mental Health First Aid. This is an evidence-based program, much like physical first aid, that can train people in early recognition when a friend or an acquaintance is having difficulty, and how to intervene to try to get them help. In other words, engage all citizens. And we've trained already, through the Mental Health Commission's offering this program, some 50,000 Canadians. Well, we're making sure that we develop a model of mental health first aid that is entirely contextual and appropriate for northern communities.
But my hunch is if you live near University Avenue in Toronto, you've got a great shot at getting access to care, and you don't if you live near Hudson's Bay.
That's right, and we need to also leverage things like our technology. All right, I'm one of those people who provides to Northern Ontario communities televideo consultation. So I can be in Keewatin or Manitoulin or other communities in Ontario in 5 minutes. And that's a technology we need to embrace far more aggressively.
Okay, let's continue this debate. Stand by, because up next we'll open this up for debate and examine what the strategy really will or hopes to accomplish for Canadians living with mental health issues. We'll do that right after this.
Support Ontario's public television. Donate at tvo.org.